In the 2019-2020 flu season, there were up to 56 million cases of the flu, which led to 26 million doctor's visits, resulting in 740,000 hospitalizations, and sadly, 62,000 deaths.
In the United States, up to 8% of people will have a symptomatic flu illness every single year. In Georgia, the flu season runs from October to May, with a peak in cases between December and February. Common symptoms of the flu include fevers, chills, fatigue, body aches, cough, sore throat, headaches, and runny nose. Once you're exposed to the flu virus, you can get symptoms 1 to 4 days later. Even before you're showing symptoms, you can be passing the virus to other people 1 day before you develop symptoms, up to 7 days after your symptoms have resolved.
Here at OB/GYN of Atlanta, many of our patients are more defenseless against the flu. Pregnant women and people with chronic health conditions are more vulnerable to the deadly effects of influenza.
The best way to prevent the flu is to get a flu vaccine.
All right, so you're here for your flu shot. Which arm do you want it in?
I'll do this one.
Okay, take your arm out your sweater for me.
Flu vaccine does not contain any live virus, which means that there is no way to catch the flu from the vaccine. After receiving a vaccine, you may report mild tenderness at the injection site and body aches. This is your sign that the flu vaccine is working and your body is making antibodies that will fight off the real flu.
Do not delay in getting a flu vaccine. It can take up to 2 weeks to develop antibodies that protect against a flu illness.
A pregnant woman who takes a flu shot protects herself, and the antibodies she makes will protect her baby for up to 6 months after delivery.
If you are sick or have recently tested positive for COVID-19, please wait until your symptoms have resolved before getting a flu shot. The CDC and the physicians at OB/GYN of Atlanta want to remind you that it's not too late to get a flu vaccine. The flu shot is available at any 4 of our office locations or a CVS, Publix, or pharmacy near you.
In the midst of the COVID pandemic, it is a chilling thought to consider the additional strain the flu season may place on the healthcare system that is already stretched to the limit.
Some patients have concerns that by receiving the flu vaccine, they will increase the risk for developing COVID-19. This is not the case, as these are 2 separate viral respiratory illnesses.
Consider this: when a person has the flu, they are less likely to be able to fight off a COVID infection and are more likely to spread the COVID virus to others with their coughing and sneezing.
Do your part, get vaccinated, and protect yourself, your friends, and your family from getting the flu.